option. Hello and welcome back to our show again. I have Heather and Nada with me. Heather, go ahead and introduce our guest today.
Welcome back, everybody. Thank you so much for being here. Today's show is an incredible show. We are so excited today because this is a show that's really important. If you are logging on and you're watching this on Facebook, chances are you don't have to scroll very far to see misinformation, disinformation, or just a general uncertainty about vaccines, COVID, and equality in healthcare. But luckily for us, there is a fix for that uncertainty, and that fix is expertise. We are joined today by Rna Fadul. She is a doctor. She is here to walk us through COVID, vaccines, where we're at in the world, and how we can all share this information with our loved ones so we can all be a little bit more informed. So welcome so much. Thank you for being here, Doctor.
Well, thank you all for having me today. I'm really excited to be joined again by Hagir and Heather now to share some information, and hopefully we'll give you the accurate information that you've been searching for so you can make an informed decision about vaccination.
Beautiful, beautiful. So how about you start off by giving us a little bit of an introduction, let people know who you are, what your background is, and how you spend your days.
Okay, so my name is Rna Fadul. I'm Assistant Dean of Diversity, Equity, Inclusion, Education Programs, as well as an Associate Professor of Infectious Diseases at the University of Nebraska Medical Center in Omaha, Nebraska. And my primary area of interest is actually HIV and HIV prevention and care, and making sure that everyone who's living with the disease has equitable access to good treatment, and everyone who's at risk of the disease also has equitable access to good prevention, because there is tons of prevention options and treatment options out there that ensure that people living with HIV can live a normal, lengthy, healthy life. They can work, study, have children, and do all of that in a very normal and healthy way. So of course, with COVID-19, all of us in the infectious disease world had to kind of change direction and use our expertise now to make sure that we're ensuring the same thing for people who are at risk or are suffering from COVID-19, to make sure they're accessing good treatment, good information, as well as good prevention practices. So that's pretty much how I spend my days now.
Oh, no big deal. That's amazing. So in my mind, I have always kind of actually made the connection between HIV research and the way that we kind of came through the 80s and 90s, not quite sure exactly what it was and how it spread, and misinformation during that time period too. Do you see the parallels there? And could you have imagined if social media was available back then? Do you think people would have been amplifying it? Do you think it might have taken longer to get to the place where we understood it better? What are the parallels between the two?
Yeah, no, that's actually an amazing question, because for many people, especially in the infectious disease world, who have been through the early days of the AIDS epidemic back in the 1980s, when COVID started early 2020, this was to them a vivid reminder of the early days of the AIDS pandemic. They faced the exact same fear, stigma, misinformation, kind of the blame game of who brought this to the world and how did this all start. This was a vivid reminder to the experts in the infectious disease world, as well as people living with HIV or people who have lived through that era of what happened then. especially the fear and the stigma. I think that was pretty vivid in the first few days of COVID-19 until we started learning more information. The only difference between now and then is that during the days of AIDS and early HIV, we didn't have access to the science and technology that we have access to nowadays. It took us about 6 years to be able to diagnose and effectively be able to identify people living with HIV. And it took us almost 16 years or so to be able to provide effective treatment. Now, all that time have now been accelerated, and we're dealing with a little over a year since the pandemic started, and now we have effective treatments, but also an effective vaccine, or multiple vaccines actually, which is very, very fortunate that COVID-19 happened during this time. But it's also kind of fortunate that, like you stated, that HIV and AIDS did not happen during this time because of the multitude of misinformation that we're facing. A very nice statement that the WHO director mentioned about COVID-19 is that our biggest threat right now is not the virus itself. Our biggest threat is actually the misinformation and all the propaganda that's out there against vaccine and against prevention measures, and all the misinformation that's circulating about how this virus started and how vaccines have been invented. That's really the biggest threat that we're facing right now in the scientific world. And obviously, social media has played a major role in amplifying those messages. So we're here to undo some of that and try to provide some, not biased, but I'm a scientist, I'm a researcher, so I definitely trust science as a source of information. I don't trust social media. I verify pretty much every single information that comes to me about COVID-19. I go and verify it first with science before I start spreading it. And I'd like for all of you to start doing that.
What does that feel like for you to have this be your expertise, to be the place where you've made your profession, all of the years and energy and time that have gone into that, to have your words kind of have the same weight as just a random shared post on the internet? Is it frustrating? Do you find it like when you have a captive audience, you can really tell who's listening and who isn't? Can we trace the misinformation back to specific sources? What's it like from your point of view?
Yeah, so I mean, for me, I think it took me a while to get to this point of settling on the fact that there are people who are on the far end of the spectrum, those who are extremely resistant to accurate information because they have their own beliefs or they have their own agenda or own motives of believing and spreading false information. And those are people that I don't spend my effort on anymore. I just listen to what they have to say and say, this is your perspective, you keep it to yourself, I'll keep my mind to myself, and we'll just move on and agree to disagree. But my real target audience is that those people who are in the middle of the spectrum, who are subject to being kind of sabotaged by the group on the extreme, and the ones who are actually wanting the right information, but they just can't find it because they're overloaded with all the false information out there. I mean, many social scientists will say that people believe what they hear first and what they hear more often. And if we're not combating that war of misinformation with a lot of accurate information, we're going to end up losing that war. So this is my target audience, those who are in the middle, who are waiting to see how this is all going to pan out, who are looking for the right information to make an informed decision. And of course, people who are standing in front of the line wanting the vaccine or wanting the right information. Those also don't really need a lot of effort because all of we need to say, yes, you're doing the right thing. Please keep doing that. And we need to just provide them positive reinforcement. So that's kind of where I'm at right now. Obviously, it took me a while to get here.
I can relate. I had a couple of different people that I love in different parts of my life all say to me, Heather, the vaccine changes your DNA. And I didn't know a lot about vaccines, but I knew that wasn't true. And so I was like, I don't know where they're all hearing it from, but they all are hearing something very consistent and then sharing it really confidently. And so I think voices like yours are going to help a lot. So let's give people like a groundwork. Let's talk about your expertise, your background, your journey to become a doctor. That way people can understand just what it takes to become someone, in your shoes.
Yeah, so I went to medical school in Sudan, and Sudan is in Northeast Africa. To be selected to go to medical school, you have to be probably in the top 10%, or maybe even like 5%, and in some places
1%.
maybe 1%. Okay, I wasn't gonna say that, Hajar, because I felt
Don't
like
be
it's gonna be,
modest. She's
I don't want to be
the
braggy.
smartest woman that I know. And go ahead, finish.
Yeah, so it really requires a lot of work for you to be able to at least access medical school. And then after that, you have to go through this very rigorous training program. So I spent all of my training here in the United States. After I finished medical school, I moved here and I went through internal medicine residency, which was 3 years of very intensive training on how to treat adult patients with different medical conditions. And then I went on and did another fellowship called Palliative Care Fellowship. And it was mostly focused on symptom control and taking care of patients who are suffering from uncurable diseases such as cancer, and that are facing the end of life and the decisions that have to come up along with that. And I spent a few years of my life at MD Anderson Cancer Center in Houston, working there as a faculty in the emergency room as well as palliative care. And then after that, I kind of dig deep in my soul and identified this passion for infectious diseases and HIV. So I went on and did another 2 years of infectious disease fellowship. So that adds to 6 years of training after 6 years of medical school. So in addition to the 12 years of, elementary and high school education, I spent another 12 years of my life between med school and med training. And I'm triple board certified in internal medicine, palliative care, as well as infectious diseases. I practice in all of those different areas, and I've been an infectious disease provider now since I finished my board in 2013. So I've been actively treating patients with different infections since then. So whatever I'm telling you today, if I don't know, I'm going to say I don't know, because there's still a lot of stuff that I don't know and that the world doesn't know about COVID-19. But anything that I tell you today, I'm telling you because I truly believe it, and there is scientific data that backs that.
So what you're describing is like the last half of your lifetime has been in schooling and science and kind of like building on knowledge year after year after year. So whenever you first got to I think we can all think about COVID-19 like the first couple of months, actually, it was just confusion. Everything was kind of happening really fast, but yet the solutions were happening slow. So when you kind of go from that year's worth of schooling and building on stuff, suddenly to get thrown this massive global curveball, how did everyone around you, how did you react to that? Were you guys kind of sifting through the same information we were, or did that background kind of give you like a shortcut knowledge where you could kind of see where it was going?
Yeah, so I mean, I think it was a combination of the background, but also the networks that we belong to. So because I'm an infectious disease provider, I'm part of a larger network of infectious disease physicians within the United States, as well as our own small networks of infectious disease providers that are global. In addition to that, I have my own infectious disease division at the University of Nebraska, which is one of the leading teams around the country and maybe even around the world when it comes to combating anything that has to do with biosecurity or international disasters. So we have one of 4 biocontainment units in the United States at our university. And I was trained to be part of that biocontainment team. So in case we get cases of Ebola or SARS or anything at our institution, I knew how to deal with those cases and how to properly protect myself and my team around me in case we deal with any of those cases. So when we had our first case of COVID-19, and we actually received the first case in the country, the passengers of the cruise ship, Princess Diamond, I think was the name, they were brought back to the US because of exposure to COVID-19 at the ship. They were brought to our hospital. So we received the first patient in the country dealing with COVID-19. So I was very familiar with what's happening at the time because of being part of that team, of the biocontainment team. I was also part of the COVID infectious disease team, the volunteer to help kind of be a resource for internal medicine and other doctors at the hospital when it comes to COVID-19, anything that has to do with testing and treatment and quarantine and all of those questions that come up very frequently. So those networks really helped me have an insider knowledge, but yet again, the knowledge was not that a lot. There were a lot of things that we just were not sure about, but we used our previous knowledge about SARS and other coronaviruses and other similar diseases and pandemics, the way they spread, and what really made sense to us, because a lot of the stuff we just had to kind of use your common sense, knowing some of the virology and the microbiology behind these viruses. So it was a very tough time, I have to admit, but having that network of support made a huge difference. And I was really privileged to be part of that. That's not something that everyone has access to.
That was a fantastic answer, because I never even thought about that. I was thinking of it like a personal thing where you were like, okay, I've learned this before, I just kind of have to remember it. But to have like a collective remembrance of everything everyone has learned, and then to actually have this be put into your lap and put it into practice, that's pretty powerful. So I feel like one theme we're going to have throughout this whole thing is that you basically are describing how we did not start at ground zero. Yes, COVID-19 was specific, and yes, this particular strain, this variant was new, but we had containment things in place. We had other things in place. So when we're talking about a vaccine, I think one of the things that is hard for people to understand is that we didn't start at step one with this vaccine. Is that a correct statement? We kind of had a vaccine in place that we just had to tweak to make it effective for COVID-19 in particular. So this is, I think, the most common uncertainty I hear about people was the speed in which the vaccine was created. But that's kind of how I've been describing it to people. Would that be fair?
Yes, and if you don't mind, actually, I'm going to share some slides because I think pictures speak 1,000 words. So in this case, I think this will show you exactly what I'm talking about and what you were talking about. So in this slide, you could probably see what I'm sharing right now. And if you're not, please let me know.
I see it. It looks good.
All right. Very good. So this is basically vaccine basics, how vaccines work. And let me go back to this beautiful picture here, because it does show how, for example, COVID-19 infection work and coronavirus infection. In this case, it's SARS-CoV-2, the virus that causes COVID-19. As we all know, it got the name of coronavirus from having this crown shape. And the crown shape is made of these, what we call spike protein. And the spike protein I think of as a key that the virus uses to enter the cell. This key has to go into the lock, and the lock in this case is the ACE2 receptor. And once that key goes into the receptor, it opens the cell, literally, for the virus to enter and dump its content inside the human cell. In this case, the human cell could be an upper airway cell, or it could be a lung cell. And if it gets down to the lung, that's where we see the damage and the trouble with breathing and the need to go into the ICU and all of those problems that we see with COVID-19. So if the virus gets into the cell, it dumps its content. And the content in this case, the most important part is the RNA. And as we know, the RNA stands for ribonucleic acid. It's not the DNA. This is different. And this is basically what we call the software that the cell uses to make protein, which is basically everything that our body is made of protein. So the RNA gets translated into proteins, and it's into a new RNA that then makes more COVID viruses. And each cell has a capacity to make hundreds of thousands and millions of viruses, depending on the type of the virus. Now, when these cells assemble, the virus assembles, and it exits the human cell, it damages the cell. Some of these cells are no longer alive, no longer functional. And that's how you get the damage that happens to the human cells, and especially in the lung in this case. Now, after the virus exits the cell, the human body doesn't just stay there watching. Our immune cell is primed to identify foreign objects and fight them, right? That's why we have immune cells. So the immune system identifies that, oh, this is different. Something happened to our body and we need to find what it is. And they identify that by finding this strange protein. In this case, it's a spike protein because it's not part of human proteins. It's a different protein. And these cells, which we call in this case antigen presenting cells, they receive this antigen, which is a spike protein, and they alert other immune cells, which are T cells, B cells, all of that basic biology that we all forgot by now. And eventually the B cells start making antibodies. And because the spike protein that's part of COVID-19 or SARS-CoV-2 is new, we never were exposed to this before, we don't have stored antibodies in our system. So in case the virus comes to our body, we're able to wake those cells and tell them to make more antibodies because we need it. Because this is a new virus to the world we've never been exposed to. But we have antibodies to other viruses, other pathogens, probably from either being infected by them before or being vaccinated. That's how our body makes antibodies. So in case of COVID-19, you can either make antibodies by getting the natural infection, which in this case, you risk being ill with some mild symptoms all the way to death from the virus. And as you know, death ranges, depending where you are in the world, from less than 1% to more than 10%, depending on the resources in different countries. So that means 1 in 100 to 10 in 100 of people who get COVID-19, we might lose them. Or you can make these antibodies by vaccination. And in this case, the way it works, instead of giving the body the whole virus and causing all this damage that we spoke about to the human cell, we make antibodies by giving the body a part of the virus, a small, tiny little part of the virus. And the part that works really well to excite the human body is a spike protein. So we have to figure a way to give the body the spike protein without causing this damage. And that's how vaccination simply works. So the technology that we all hear about, all this false information that we hear, is messenger RNA technology. I will speak about that in a minute. But before I go to that, I wanted to show you how this was done so fast, because that's a question that comes to a lot of people's mind. And a scientist like myself, a researcher who spends a lot of time getting some data from a single research study, always questions, how did that happen so fast? So I had to go back and educate myself about how this happened. And this diagram shows us here on the top, the traditional development of vaccination, which can take anywhere from 10 to 15 years. And what also happened in the SARS-CoV-2 case, which took about 10 months to 1.5 years. So this will give a pause to anyone saying, oh, how did we go from 15 years to 15 months or so? And the answer is simple. The answer is two things: money and political will. And this is exactly the opposite of what we've seen earlier during the AIDS pandemic, because earlier during the AIDS pandemic, if you all remember, there was a lot of political will against AIDS research. There was withholding of money, federal money, from helping with ending the AIDS epidemic. And that's why that epidemic continues till this day. With COVID-19, we could not wait that long because we would have lost a lot of the world's population if we waited that long. So we had to do something very quickly. So a lot of money was poured into making vaccines available, and a lot of political will came together to help that happen. They did not skip any of the traditional processes. As you can see them here, it goes from first identifying the target, which was the spike protein. The Chinese released the genetic code of the virus very quickly back in January. The minute they were able to code the virus, they released that to the world. It was available on the internet. Each researcher was able to access that and make their own spike protein in the lab. And because there was a lot of money thrown at these researchers to be able to do that, that happened very quickly. So instead of taking 2 to 4 years of writing grants and being rejected and writing them again, this happened within months, and that's usually what slows science, is just not having enough funding to do these things. I mean, researchers are brilliant. They're able to get this done if they have the enough resources. So they did have the resources. They were able to develop this very quickly, test it in animal, prove it's effective, and then they moved to human studies. And in this case, instead of finishing phase 1 and then going to phase 2 and finishing phase 2 and then going to phase 3, as you can see, they overlap these studies. So the minute the phase 1 study showed that this is safe, and usually phase 1 means you test it on 10 people or so to make sure it's safe, it's not going to kill somebody. The minute they finished with those, they started phase 2 study. They tested it on hundreds of people to make sure it was effective and it's actually going to release some antibodies. And the minute they learned that, they started phase 3 study. And of course, you have to remember, in the case of COVID-19, because it was a pandemic, there were tens of thousands of people around the globe who were willing to participate in these vaccine trials to expedite science. With usual vaccine trials or treatment trials, it takes years to recruit people, especially if the disease is rare. But in this case, the disease was a pandemic. So we effectively were able to tell this works, this prevented people from getting COVID. And we had lines and lines of people waiting to sign for these clinical trials. The other thing that expedited the process is that the fact that the regulatory agency, in this case, the FDA, was getting information continuously from all of these trials as they were happening. They didn't wait till the trials finished before they send them to the FDA. They send that information continuously since the start of the phase 1 trial. So by the time the phase 3 trial finished 60 days, and we knew this vaccine is safe, effective, and it works in preventing COVID-19 after 60 days from getting it, the FDA was able to make a very quick decision over the Thanksgiving weekend saying, yes, this should be approved for emergency use authorization. And we have to remember that's different than just regular approval, because that's a contingent approval. We're approving it because we really need it and it's going to save lives, so we can't withhold it any further. But these studies still have to continue for the regular duration, which is 2 to 3 years, to prove that they work and they work long-term and they don't have any long-term side effects. And by the time they got 60 days of data, it was very clear that this vaccine has very minimum harm, very few side effects that people experience, but it saved a lot of lives and prevented a lot of infections. So they had to move on and approve it. But as I mentioned, the studies are still continuing. They're still being monitored for anything that's unexpected. Many people talk about long-term side effects. These vaccines were not studied for a long time. We have to remember, long-term side effects from vaccine means side effects that happen within 45 days of getting the shot. That's when we say these are long-term side effects. They don't happen after years. We haven't seen that with any of the vaccines that are available to date. So why do we expect that to happen from these vaccines? I just still don't know the answer, but we might be surprised. We might find something. That's why these studies are still continuing. Now, when I talk about the money and political will, all of this was done under what we call Operation Warp Speed. And this is a massive operation that brought multiple US agencies together. And they were given $10 billion to be able to produce a safe and effective vaccine with the first dose available by January 2021. And as you all know, they beat that deadline. These are the agencies that were part of that operation: CDC, NIH, BARDA, DOD, even the military was part of this operation to make sure they use the resources. And there were multiple private agencies which were part of that operation. As you can see here, things like McKesson distributors, FedEx, UPS, Pfizer, Moderna, the military, CDC, as I mentioned, all of these agencies were part of Operation Warp Speed to make sure they work all the way from manufacturing the vaccine to delivering it to the right subjects. So I'm going to stop here because I spoke a lot, and I'll give you a chance to say any questions.
You did not speak a lot. Hey.
Incredible. That was
all
amazing.
valuable information, and it put a lot of stuff into perspective. I don't know how about you, Heather.
Yeah, I mean, you just answered like 1,000 questions all at once. That was fantastic. And the visual aid, you're absolutely right, is totally valuable. So I hear you exactly what you're saying. And so that, I think, answers the most common question I had is, how did it happen so fast? And I've never actually thought about the phrase political will to actually do it. And then comparing that to the anti-political will for HIV is very powerful. So basically, instead of the government working like we're used to working, like the DMV, everyone dreads going to the DMV. Instead of that being a part of this process, they basically plucked out all of that government inefficiency that we know so well and infused it with money, put the money in the right hands, and tried to pave it as smooth as possible so that when everything was done, it was ready to go. Is that fair?
It is very fair. And I compare this to the actual thing that happened in China. China built a hospital in 10 days. Right? Who would have thought like you can build a hospital in 10 days? Like, how long does it take to build a hospital? Maybe 10 years, right? Mm-hmm. But during a pandemic, you had to do that. You had to build a hospital within 10 days. And they built a very effective, well-equipped, extremely well-done, designed hospital within 10 days. And so if you pour all your money, all your agencies, and have them come together and work together, you can accelerate a lot of things. So that's a very vivid, good example of how things can be done.
Yeah. And I mean, honestly, we had all, like, the world had come to a stop. It wasn't just like me and my house and my job. The entire globe had come to a stop. So having everybody suddenly have nothing on their plate to be able to focus on it, that makes sense too in terms of speed. So another thing you talked about was long-term effects. I do have a lot of people that kind of make jokes about, well, I'll see you in a year whenever everybody starts to like fall apart or become zombies or whatever they say to be funny. But when you said that, I had never actually heard that yet. Even someone who would like to be informed never knew that the long-term effects really are contained. And I guess if you kind of compare it to other vaccines, that makes sense, that we're not waiting a year to be effective.
Exactly. And, a lot of people talk about the messenger RNA. This is a new technology. We haven't really seen the long-term side effects of that. And maybe we'll see something different with these vaccines, which is a good point. It's a valid point. I'm not going to dispute that. But you also have to remember that the messenger RNA technology for COVID vaccine is new, but the technology itself is not new. It's been used before. It's been used in other vaccines. So Zika, influenza vaccines, CMV vaccines. These are all, except for influenza, are very rare diseases. So that's why we were just not able to see the results of these studies yet, because they're still ongoing and they've been ongoing for, a lot of years now. But because these diseases are rare, we're not able to recruit as fast as we did for the COVID-19 studies. But the technology is not new. It's been tested before. We have humans who receive these types of vaccinations, the mRNA vaccine specifically, or mRNA derived medications before, and they're still doing fine, and we haven't seen any long-term side effects. So all that combination together of knowing vaccine side effects in general are limited to the first 45 days. That's why the studies they waited for 60 days from the time this last subject received the vaccine to make sure, okay, now it's safe and now we can say you can go ahead. But we also know from previous data, even though a lot of it is not published yet, that these mRNA technology types of vaccines are generally safe and they don't cause long-term side effects. So that's what prompted us to all feel comfortable and stand in line and be the first ones to say, try it on me. I'm willing to take that risk.
Mm-hmm.
Yeah. We have a question here. Nassar Ali, he's asking, so why it causes blood clots?
So that's a very good question. And I have to clarify in this case, it's not the mRNA vaccine that causes blood clot. So blood clots were identified with two different types of vaccines. One of them is called the AstraZeneca Oxford vaccine, which was developed originally in the UK. And the other one is the Janssen or Johnson & Johnson vaccine. Both of these vaccines are what we call vector vaccines. And I can share my slides again to explain that again, because I think the picture is again going to show this much more effectively than I can. So this is what a vector vaccine means. A vector vaccine means you bring a different virus, a virus that's not harmful to humans, or maybe unable to infect humans. So in the case of one of these vaccines, for example, they chose a chimpanzee cold virus called adenovirus. And they used the shell of that virus and they put the protein, spike protein, inside that shell, and they gave it to the human body. So in this case, that's why we call it a vector, because something else is carrying the material that's going to excite the human body. We have to make sure that we all understand that this does not give people infections. It does not cause them to get infected by the original virus or by COVID-19, that the virus vectors are basically unable to cause human infections. And they also do not interact with the human DNA in any shape, form, or fashion. All they do is deliver either the message that makes the spike protein or the spike protein itself to the human body through this vehicle of the vector. So these are the types of vaccines that were associated with the blood clots. Now we have to also remember that millions of people receive these vaccines, the AstraZeneca and Johnson & Johnson. Because we're talking about the United States in this session, I'm going to focus on the Johnson & Johnson vaccine because, as you all know, vaccine was put on hold for a temporary period until they investigated, and they released it back to the public. So it's now available. The advantage of that vaccine is one shot. It's one shot and you're done. 2 weeks later, you're immune. Now the CDC says you can take your mask off, which is a big plus for those who are vaccinated. But we also have to remember that by the time they put it on hold, 6.8 million people have received the vaccine, and we've heard of 6 blood clots. So 6.8 million and 6 blood clots. So that's less than 1 in a million of people who got the vaccine and got a blood clot. Now, there's very few vaccines, or maybe none, in the world that we give in that massive amount in such a short time. Because we've never vaccinated this amount of people in such a short time, and we never monitored the side effects this closely. You know, the CDC has this amazing comprehensive monitoring site where you can go and register any side effect that you got from COVID vaccine. You know, if you had a pimple, you could go there and say, I got a pimple after I took the COVID vaccine. So anything that you get the day after.
Had a bad hair day.
Use this.
You can do that too, a bad hair day. I'm not joking though. You really can go and put anything, even if it doesn't make sense. You can put it into the registry and say, I got this the day after COVID. And people do that. And it's fine because we want to make sure we capture every single side effect that can potentially happen from this. So we were able to capture things that are less than 1 in a million. And that really provides me with a lot of safety and peace of mind to know that the system works this well, that we were able to capture such rare side effects. But again, it's only 1 in a million. It happened a very selected group of people. Most of them are young women, women of childbearing age, you know, around or less than age 50 plus. And those are the ones who experienced this very unfortunate event of the blood clotting. And it's pretty serious, but again, it's very, very rare. So when you take that risk of getting the blood clot versus the risk of getting COVID and dying of COVID, we said it's about 1 in 100. Now we're talking about a risk of 1 in a million.
I mean, and for context, I mean, birth control has a really high occurrence of blood clots, and 50% of the population is walking around popping those pills every day, and we're fine with it.
Yeah.
Absolutely. That's a very good point. And actually, in a lot of these cases, not so much the ones in the US, but the ones globally, we don't even know that could be a compounding factor. And maybe that's why we're seeing it in young women of childbearing age, because they might be taking birth control or something else that could have caused them to have a high risk of blood clots. But, you know, it could have happened with all other vaccines, for God's sake. You know, we don't really know if this happened from influenza or happened
with anything, Neda, with anything, not just the vaccine.
Exactly.
I mean,
but I've never seen any of my friends. Go ahead.
No, I was just going to say the risk of blood clots in general is actually about 1 in 1,000. This is, you know, it's not an unknown fact that 1 in 1,000, 1 in a few thousand people, just without any risk factors, might get blood clots. So
yeah, but yeah, I don't normally see my friends and family up in arms about all the blood clots that could happen and wanting to change birth control to be safer. I think it's just what you're talking about, the general misinformation. So let me ask you one more question that I got a lot from people. Then they wanted to know why it is that we get sick after we get the vaccine. So like, for example, I got, I don't even know, Moderna or Pfizer, I don't remember which one. And first one, nothing. And then my second shot, everyone kept saying, oh my gosh, be careful, you're going to get sick, take off work that day. And I ended up being fine. And I mean, maybe a little tired, nothing to even note had they not gotten me a little bit in my head about it. So why do we get a little under the weather, specifically with the COVID vaccine?
Yes, I think it's a lot of factors. I'm sharing my screen here again to show you that when people tell you take a day off work or, you know, be careful, they're not really exaggerating, because it has been shown that the second dose might cause more side effects. I'm sorry, I have to share this again. So as you can see from this slide, this is the first vaccination, and this is the second vaccination. All of these side effects, the bar was longer with the second vaccine, and it's also shown here, the first dose and second dose, the percentage of people who got pain, fatigue, headache, muscle pain, fever, joint pain, chills, nausea, swelling, all of that was higher with the second dose, which is shown here in red, compared to the first dose. So yes, the second dose does cause more side effects. I tell people it's actually a good thing. You know, if you get side effects, that means your immune system is working, and it's working really hard to react to this. None of these side effects are life-threatening. You know, you can probably just take a little bit of Tylenol or ibuprofen or something, and you'll probably be fine the next day. At the most, it might take 2 to 3 days for you to become back to normal. So that's just something to keep in mind. Yes, side effects do occur. I had a little bit of pain at the site with my first dose. My second dose, I could not get out of bed, but I had to work. So I had to go to the hospital that day. So I took some Tylenol and drank a bunch of coffee and was able to finally get out and go to work. And I was fine the rest of the day. So.
And is that just the side effects are just kind of vaccine, not COVID specific per se, but that's just the way all of those symptoms are the symptoms of your body fighting something, not COVID in particular.
Yeah, so I mean, before the era of COVID, I had a lot of people tell me, I don't take the flu shot because I get the flu when I take the flu shot. And I'm like, well, if you ever had the real flu, you would never say that because
Exactly. Yeah. The only
yeah,
side
these are
effect
common.
I had, it was my the injection site. I had pain that lasted for what, 3 hours, and then I was fine. And even my youngest, she's 19, and she took the first had nothing. The second, she had nothing but like a headache. In the morning, she took Tylenol. She was fine, like nothing basically.
Yeah, and I think the other factor with this is that we're looking hard for those side effects. Like I was primed like you. Oh my God, it's my second dose, and I've seen those figures. So I must have more side effects this morning when I wake up. So even if I didn't have anything, it was already in my head that I'm going to have something. So I think psychology plays a role in that as well.
It's mental, I think. Mohammed Babikir is asking you in Arabic, ما هي خطورة التطعيم للأطفال في مرحلة النمو? What is the danger of the vaccination for kids who are growing? My daughter is going tomorrow. She's 13, my second child, and this is her first shot. So I think his question is if there is any danger for this age.
Yeah. So if you think about other vaccines again, majority of vaccinations are given in the first 2 years of age, right? Like that's when you take your child to the pediatrician and they give them 4 shots in every thigh, and you're holding them and everyone is holding them. And the whole clinic can hear the scream, and you're just like, your heart is broken because of all those shots that your child got, right? So that's when the majority of vaccination happens. And again, we haven't seen anything. If anything, we've seen that our kids now don't deal with polio and measles and all of these real horrible diseases that used to kill people back in 200 years ago or so. So vaccination made a huge change in the world that we're not seeing people suffer from these diseases anymore. Now, with COVID vaccine, we just don't have that data. We think it's probably going to be safe. Pfizer is now studying age 2 to 12. They've already approved age 12 and above of the Pfizer vaccine. So that's why Hagir's daughter, 13-year-old, is going to get the vaccine. My son, who's 15, is going to get the vaccine shortly as well. So that age above 12, we know the vaccine is very safe, it's very effective, it's been studied on thousands of people, we're very comfortable. We just don't have still enough data on younger ages, but we think it's probably going to be okay, just like all other vaccinations were.
And I think the important thing...
Oh, sorry, Heather, go ahead.
You can ask the question.
Nassar is asking why some people have no side effects.
Yeah, so I think it's probably just a blessing that you don't have a lot of side effects. Again, it's not unheard of. And when I say your immune system is working well when you got side effect, that doesn't mean it doesn't work well when you didn't have side effects. It just means that your body shows it differently. Like, we all hear about man cold, and I'm not really joking in this case. So it's the same influenza virus, it's the same cold virus that infects the woman and the man at the same household. The man is sick and covered in 10 blankets for 3 days, and you have to bring him soup and juice and all kinds of stuff to bed. And you have the same cold, and you go to the kitchen, start cooking, cleaning, doing all kinds of chores, without complaining. So it's just that people's reaction.
Sorry, you better not do that.
And I feel like it's important context too, that not only are you describing the fact that the vaccines are safe, they are routine, and any side effects are mild, but the alternative is to not be vaccinated, and the alternative is to get COVID. And I'm curious to know if you know what long-term side effects are. So like we're talking about how quickly the vaccine was created, but during this time that everyone's had COVID, we have now been, I assume, gathering data for people that have had COVID in 2020 and are still dealing with side effects. So what are the long-term side effects of getting COVID versus just going and getting your vaccine, booking your appointments 2 weeks apart and taking care of it?
Oh my God, that's an amazing question. Because in the beginning of COVID, we used to think you either make it or you don't. And if you make it, then you're fine. You had COVID, you might have some antibodies, you will not get reinfected at least for the first 3 months. and you're done, right? But now we know that's not true. Now we know there's something called long COVID, Long COVID, and you can Google it and find a lot of information about this. And it presents in so many different forms and shapes. Anything from neurological damage, damage to nerves, damage to mental health, to physical damage that can happen to the heart and lung tissue. Some people never recover from actually needing oxygen after COVID because the damage that happened to the lung is just irreversible. Some people end up with multiple complications to their heart and dealing with heart failure and weak heart muscle month on month and maybe even a year after recovering from COVID-19. The mildest form of side effect that I've seen, or long-term side effect, is fatigue. People who are now dealing with what we call chronic fatigue syndrome, they're just never able to go to that baseline of being fully functional and working full time and being able to do all the stuff that they did before having COVID. And that's very unfortunate, because if you think about somebody going back to normal, you have to have that level of energy and you have to have that level of productivity in order for you to go back to normal. A lot of my patients who have COVID, they were not able to go back to the same jobs that they had before COVID, unfortunately, because of these long-term side effects. We have seen
having a normal.
You don't really have a normal. Yeah, I mean, a few people, or a good percentage probably, is able to go back to normal and function again and be fine. But there is also a very substantial group of people, and we just don't know the numbers yet because we're still studying this, of who suffers from these long-term side effects. A lot of it is also psychological. I mean, just going through that trauma of dealing with a new disease that you don't really know how this is going to end, and being isolated from your family and loved ones, and just feeling that, just this is weird. This is never happened to me again, or never happened to me before. A lot of people who have COVID, they say this was different than any other disease that they had in their life. I'm talking about people who live in Africa, who dealt with malaria and typhoid and all kinds of diseases, saying that this is very different than anything that they've dealt with. Just having to go through that trauma by itself can leave you with long-term side effects. So yes, don't take it for granted that, oh, I'll just get COVID and I'll probably be okay, because you might not, even if you recover.
Because I've seen a lot of that. I think the COVID fatigue of us just kind of getting used to it. Like at the beginning, I was like washing my groceries. And so eventually, you learn more and you don't have to do as much and you get a little less vigilant. But there has been a little bit of a shift even farther from that, of people just saying, come what may, or my friend got it and she was fine. So there's been a weird shift with that, where you've almost resigned yourself to gotten it, or have tried to romanticize it in a way that makes it better than the vaccine.
Yeah.
And
not really
both
that
of
simple.
my brothers, I'm not sure if you know that, Nida, but my older brother, who live in England and work at the hospital, he had it really bad at the beginning of the COVID pandemic. We were worried sick about him. And recently, after the passing of my mom, the middle one, who live in Qatar, had it also, but his was even worse because he ended up needing oxygen, and he was on the vent basically for a short period. He recovered, but you can still hear it in his voice when he talk. I mean, his lungs are still beat up big time, injured. So many people are taking this for granted, and especially in like areas like Sudan and areas that they don't have what we have here. And the chance of them dying or getting really injured and have side effects are worse than someone who's going to be able to receive top care per se. What would you say for anyone who's still in denial, if they're here in the US or anywhere in the world? It's a lot. I know you deal with this every day. So what would be your advice?
Yeah, I mean, unfortunately, I've seen a lot of that, and people only change their mind when it happens to them or their loved ones. And unfortunately, by that time, it's a little too late, because you've already hurt people. And if you don't want to do it for yourself, just do it for those who are around you, who are vulnerable, who you might lose them because of your carelessness or because of your inattention to what needs to be done. So I think that's kind of one of the saddest things that I see, that people are like in denial until they lose a loved one. And now they realize, oh my God, this is serious, and they have all of this guilt and all of this shame about not believing in it. But we've lost millions of people around the world. I don't know why you have to wait till it happens to you before you believe this is real. I just, to me, that's one of the very hard to understand phenomena that we're dealing with right now. We never challenged the fact that diabetes is real, or high blood pressure is real, or heart disease is real. Why do we challenge so much science? I mean, the amount of science we have right now behind COVID-19 and its transmission and all of these vaccines is probably more than we had with any other diseases in such a short period of time. So there's nobody really who's going to benefit. I know all these conspiracy theories about Bill Gates and all of these. I'm like that doesn't make any sense to me. Like, if Bill Gates wants to control us, we have the device for him to be able to control us, and it's right here. It's called cell phone. He can track us. He can do all kinds of stuff. He can do the same thing we're doing right now by going on social media and spreading either false or real information about whatever he wants to do. But why would he go through such a huge burden of creating a virus, and inventing a vaccine to treat that virus, or treatment? I mean, this doesn't make any logical sense. So I think we all have to go back to just being human, being kind, being caring for each other, and being logical, and just stop for a minute and talk to yourself and say, hey, like, is this real? Like, what am I doing? Is that making sense to even me if I stop and think about it? We have to like take away our frontal lobe hijack that's happening to the world right now, and just stay for a minute and be logical. And I think you can find
conspiracy theorists will continue. Conspiracy theorists will continue, with global warming, everything else in between. Can you see Janela's comment, Heather, or do you want me to read it?
You can read it.
She actually wrote 2 comments.
Go ahead.
She said, I have a long time symptoms periodically of severe aches in my legs lasting about 2 weeks, followed by coughing spells. I had COVID February, which is a year ago. This occurs every few months. So she's basically confirming what we were saying about the long-term side effects. And she said, many people that do not believe in COVID and its effects harbor insecurities and fears of the unknown within themselves. And true, Janelle, it's just an issue. And unfortunately, people like Dr. Nada, are fighting the disease, and at the same time are fighting those conspiracy theorists and all those misinformation out there. Nassar is asking, how long does the vaccine last?
And the answer is, I don't know. I think we all know for sure that it lasts for 6 months, because the Pfizer studies have been going on for longer than that. So we know for sure for 6 months, but we anticipate that we might need, we just don't know for sure, but we anticipate we might need a booster or a vaccine for the new variants or something else down the line. We just don't know that when that's going to have to happen.
That's amazing. And I think sometimes, like when we're talking about having to put ourselves in other people's shoes, some of the scenarios we've been given are a little bit obscure. Like whenever we talk about maybe children who have a disease and they're immunocompromised. I don't personally have anyone like that in my family, but what I do have is some people that have COPD or asthma or other things that I feel like other people aren't realizing are those comorbidities that can also make COVID worse. So even though we're not taking it to the extreme, there are plenty of people in our daily lives that could be affected by COVID in a real way that don't maybe present as vulnerable.
Absolutely. And that's a very good point. And even young people. I mean, Hagir just gave an example of her brother who's young. I've seen many young, healthy people who feel like they're invincible and they got COVID. We lost some of them due to COVID, and some of them ended up with severe long-term side effects. I mean, we just published a case a couple of weeks ago about a young lady in her 20s who was a college student who ended up with psychosis. I mean, literal psychosis due to COVID-19. And we could not identify any other factor, anything that happened to her life other than getting COVID-19 a month prior. And she was basically completely non-functional on multiple psychiatry medications to be able to control her delusions and hallucinations, which was very unfortunate. This was a bright young woman with a lot of potential, and getting this virus just basically completely changed her life.
Yeah.
So let's, I don't want to take up too much of your time. You're a very busy woman, but I want you to kind of, like we spoke at the beginning, our target audience today are people who want information, who are looking for information, that want to know how vaccines work, that want to know how this vaccine came to be so quickly, who would like some of those common insecurities and uncertainties answered. So could you just give us like a quick recap, speaking to those people, why they should get the vaccine, why they don't need to be afraid of the vaccine?
Before the recap, just answer Muhammad Babik your question quickly. He said هل الذين أصيبوا بالمرض وتعافوا يحتاجون أيضا للتطعيم بالرغم من اكتسابهم مناعة. So his question to translate is the people that who got the COVID, would they still need the vaccination even though they had immunity or?
Yeah, that's a great question. And, I'm going to provide you as a Q&A resource because we obviously could not cover everything. Yes, because there's a lot of great questions out there that we couldn't cover today, but people who got COVID should get the vaccine, and they actually should be really careful about getting the vaccine, and they should care a lot about getting the vaccine, first of all, because they know what COVID is like, and they don't want to go through that experience. But second of all, because this philosophy of getting antibodies and becoming immune is not really accurate. We've seen cases of reinfection after somebody getting COVID. We've never seen them within the first 3 months after getting COVID. So we have to be clear about that, but they do happen, and they can happen after 3 months. So if you want to delay taking the vaccine for whatever reason, you have 3 months from your first infection, but you also have to keep in mind that the vaccines take a lot of time to work. You need to wait 2 weeks after your second dose before you're fully vaccinated. So yes, please get the vaccine if you had COVID already. You need those antibodies from the vaccine, because antibodies from COVID themselves, your body might not even form them. And if they form them, it might not last for 3 months or greater. So we have to make sure that message is clear and loud to everyone.
And also masks. Sorry, that's an important one. The newest guidance from the CDC is if you're fully vaccinated. So you just made a good point. So fully vaccinated means 2 weeks after your last shot. So let's define fully vaccinated better. But also, what do you think about that? Like again, with the humanity and trusting each other, I don't know that I am fully trusting, even being fully vaccinated at this point, to go out without a mask, to do my job without a mask. What do you think about that new guidance?
I think there's a lot of controversy. I have to be honest about this new guidance, because if there is a very reliable, easy way, like if you could tattoo it on your forehead and say, I'm fully vaccinated, walking to a grocery store, for example, then yeah, okay, this person is fully vaccinated, they don't need a mask, and this person is not, so they do need a mask, but that's not the reality. So how do we even know that the 100 people in the grocery store right now, they're all fully vaccinated, therefore we can tell them to take your mask off safely? So therefore, until we have a system where we know how we can differentiate those two groups, or if you're in a small setting where you can differentiate those groups. So let's say you're inviting your friends over and you know they're all fully vaccinated because they're friends and you've been there with them and you know how it happened and what. So if that's the setting that you would like to exercise this, please, by any means, invite them over, take your mask off, enjoy that social life that we've been deprived from for the longest time. But in public settings, in places where you can't really be sure who's doing what and so forth, you have to do it for yourself, because you can still get COVID after vaccination. Remember, the vaccine prevents you from dying from COVID, from being hospitalized with severe COVID, but does not prevent you from getting COVID. And the other thing is that we don't know for sure 100% that people who get the vaccine are not able to transmit the disease to others, because they can still get asymptomatic infection, although we know the vaccine reduces that dramatically, but it's not zero. So you might have got the vaccine and you might have an asymptomatic infection, or maybe even symptomatic. You might think it's something else, and go to the grocery store and give it to that old lady standing at the counter who has not yet been fully vaccinated. So we have to do that responsible thing for us and others, but in small controlled gatherings. Please enjoy your life. I did that this weekend with a group of friends and family, and I took my mask off, and it was really good to be able to do that, because I knew for sure that I'm going to be protected and I'm going to help the others around me get protected as well. by being vaccinated.
Yeah, it's crazy how freeing that feels. Like walking in somewhere, you're like, oh my gosh, I did feel a little like exposed, but then you were like, oh, this is so nice. I can see your face. Yeah.
Mhm.
So, okay, give us
the heart. I can never make a perfect heart, but I just want to say I love you. We appreciate you. Everyone here is thanking you for your time, for the information, and we didn't even get to the best part to talk about diversity. And Heather, go ahead. I didn't want to cut you off.
I know we do this every show. I have this big long list of questions for you. I mean, it would be so interesting to ask you about what's the future of HIV. How do we break stigmas in general for things? Yes, you are in charge of diversity, equity, and inclusion. Do you want to give us a quick 30 seconds about that, just like in terms of what that means in the modern day world?
Well, I wish I can, because I'm looking for my elevator spiel. I haven't found that yet, but I think it's just what the world needs right now. I mean, that's like, isn't that obvious that diversity makes us stronger and equity is what we really need to get back to normal? Because if we had equitable access to the whole world of COVID vaccination and COVID treatment and COVID prevention, we would have probably beat this pandemic a long time ago. So this is a time when we realize that diversity is really important. It's our strength. We realize that equity is absolutely needed, and we really realize that we need to put people who know how we can diversify and how we can reach equity on the table. We need to include them. And we also need to have justice. I can't forget that part, because this past year, 2020, with all the pain that we went through, it became much more painful when we lost George Floyd. And when that became very obvious to the world that there's no justice and we need to have justice. So it's not just DEI, I always say JEDI. So we need justice, diversity, equity, inclusion for the world to become a better place. And my last words is, please get vaccinated. And if you're not, and until we get out of this, please practice your 3 W's: wash your hands, watch your distance, wear your mask, and avoid the 3 C's: close contact, confined spaces, and crowded spaces. And we will get out of this. You know, humanity beat a lot of things before, and I'm 100% sure that we'll get out of this, but we just need to be sensible in order for that to happen. And thank you for the background. I love it.
I had this. I have to move my head so you can all see diversity. But go ahead, Heather.
I was just going to thank you, Dr. Rna Fadul. Thank you so much for being here. I know you're busy. I know that you have a lot of things on your plate, but taking the time to talk to us, talk to our friends, our family, our neighbors, helping get them that information. I honestly think that this is one of the most important shows we've done just in terms of making a real world impact. So thank you so much.
Thank you for having me. And I'm happy to come back and talk more about all the other stuff.
I was just about to say that. We want you to be a permanent guest. We are going to refer to you with every question that we have. And this is just first part. We would love to have you to talk about your amazing work, the diversity, your amazing work with like Sudanese community and fighting the corona. Nida is a force to reckon, like seriously. I can't say this enough, but go into her website, her page, Facebook page, watch the videos, watch everything she does, not just for her community here in the United States, but worldwide, and especially the Sudanese people who are watching. She contributed a lot, not just to the Sudanese revolution, but to the education. She worked closely with the Minister of Health in Sudan and sending supplies, getting, ton of information and knowledge out there. I cannot talk enough about you and شهادتي فيك مجروحة Dr. Nada, but we would love to have you again and again and again, if you will allow us.
Thank you. I would love to be back. I will do anything for you, Hagir. And now, Heather, thank you so much for having me.
Thank you so much.
Thank you everyone for watching, and I hope this was informative enough for you. And like Dr. Nada said, please follow the guidelines, still be safe. You can still have fun after you get vaccinated, but be careful with everything you do. We'll talk to you soon.